Thank you, Nancy. It now gives me a great deal of pleasure to introduce somebody who I've again known for many, many years, who has been with the National Committee to Preserve Social Security and Medicare for many years. He's now the head of that organization, does a great job representing seniors. Please welcome Max Richmond, President of the National Committee.
Good afternoon, everybody. Thank you, Senator. Once, I don't know if Senator Harkin remembers this, but once he introduced me as being with the National Committee to Preserve, Protect, and Defend Social Security and Medicare forever and ever. Remember that? And I thought our name was already long. You know, Senator, when I was driving here this morning, I thought in my spare time I would start lobbying for the creation of a Mount Rushmore for defenders of Social Security, the elderly, the poor, the middle class, children. And I would recommend your image be the first one on there. I also want to acknowledge our volunteers who are here. Raise your hand. They were with us this morning. Thank you so much for sticking with us. We did an event this morning on the House side where we presented 106,000 letters. We call them our famous blue letters to members of the House of Representatives. And we had quite a few members of the House who showed up and accepted those letters. These letters reflect real people. Inside Washington, we often talk in statistics, theories, formulas. The people that I'm going to introduce in a few minutes are real people. The people that sent those letters are real people. They have real problems. They have real struggles, and those need to be addressed. Last Tuesday, it seems like weeks ago, but a couple days ago, I was invited to a small meeting at the White House with a lot of labor leaders and progressive representatives from progressive groups. There were about 9 or 10 of us. And we each went around the room to speak. And we had the President's entire economic team, Secretary of the Treasury, Chair of the Council of Economic Advisors, key aide Valerie Jarrett, his Chief of Staff, and the Vice President and the President. So it was an honor for me to be there representing our organization. And we went around the room a few times to speak. And one of the times I spoke, I talked about Social Security. I made the strongest case I could that Social Security, as you have both said, is not bankrupt. It's not in crisis. Whatever changes need to be made in Social Security should be done separate from these discussions of the debt. And thank you. And I think that the people in that room recognized my position. Social Security, as I've heard Senator Sanders, if I want to see him, I turn on the television and watch MSNBC because he's there many nights, and you know that too. And he's made this case over and over again. Social Security has not contributed 1 penny to the federal debt and the deficit, and it should not be used to solve these problems. So I thank you, both of you and the House members that are here. Mike, I'm glad I started explaining all this to you years ago when you first ran. So just as our letters reflect the importance of these issues to real people, we have 4 individuals here today, and I'd like them to come up and speak briefly. First, Nettie Hales, I hope I'm saying that right, from New Jersey. She's a D.C. resident, an active member of our organization. I thank you for being here.
I thank you for presenting me, and it's a real joy on my part to be here as a senior, also a recipient of knowing that I'm here today because of the time that my husband and I spent paying into Social Security. Otherwise, I don't know how I would survive. I want to say that I am grateful to those of you that take the time, because we were told that when we reach seniorhood, these were going to be the golden years. And we're still looking for the gold. We haven't given up on the gold yet, but we know that who has the gold. And we're not trying to take anything from anyone. This is what I find so disconcerting in all that we read and hear about. The time and energy, even today, to expend this kind of time when we could be grouping together to see what good we could do to make this thing work. If it's not broken, why are you trying to fix something that's not broken? It's not broken. We don't have too much that's not broken. And I tell you, it is said that you can look at a people, an institution, a country where they take care of their young and their aged. And I want to say that America does not need to have an image of elders like me that are on the street begging, because we've already, we know now that we could not assure the way our country has grown. And one of the blessings that we have as seniors is the fact, thank God, we're living longer. And especially as females, we're living longer and alone without someone to back up. And that's what it was all about when we went to the altar. We thought we'd always be together looking out for each other. But I am a widow and have been for a number of years now, and thank God. And my husband was a service person in World War II, and I thank God that when we needed to pay into Social Security, we did. However, what we ought to be working together on is how we can eliminate the high cost of staying alive. It's wonderful to be able to be alive. My husband had a stroke, and he died just a few months short of 10 years into a stroke. I wished I had the whole day to tell you what it's like to go through a stroke that you survive. See, survival is wonderful, but it's the circumstances of which you survive. The likelihood of it costing you less after a while, there's not too much left if you go almost 10 years. And I want to express appreciation to the young people that are here. I wished that we could take this time and let the young people know how important it is that you care about. And what would they do but tell us that, well, there won't be any money there for your children. Well, tough, because the children of today get salaries that are unheard of. I have had family as well as friends in nursing facilities that it might cost them $100,000 a year just to stay there. They never made that kind of money, even when everybody in the house was working. So how are they going to be able to survive? So I want to say to you, my most important message that I'd like to leave with you is some words. I'm sure you've heard them before, and they're called, I better stick to my little note here. It says, I think it's down here, do not go gently into that good night. I'm sure some of the younger people that remember, and some of the older ones that still remember, but to rage. And that's why I'm here today. Not just to, I want you to rage. You know what it means to rage? When you get angry about something, you do something. Let's do something. Let's do something. And most of all, I am very grateful to the fact to be able to stand here today for so many people, not only of my family. We could all tell a personal story, I know, but for my family and all of those that are not here to speak, I'm speaking for them. You see, when you look at me, you're looking at millions just like me who are surviving with the Social Security that they earned. And I want to take away the fear that we have. They are trying to hold us down with fear, doubt. We have none of that. Let's rage.
Right.
All right. Well, our next speaker, we know him through the Senior Service America, John Reel. Now, John, Senator Harkin had to follow Bernie. You've got to follow Nettie, so good luck. Is he here? There he is.
Under threat of defenestration, I was asked to limit my remarks to less than an hour. Mr. Chairman, fellow members of Congress on the committee, fellow Americans, good afternoon. My name is John Reel. I'm a participant currently in the Senior Community Service Employment Program known as CSEP. And here today, it's a privilege to share my experiences that have shaped my awareness and appreciation of how important Social Security and Medicare and Medicaid are to the Americans. I'm one of thousands who received job training skills through the CSEP program. Currently, I'm seeking regular employment. I've been participating in CSEP for 2 years, first with the Jewish Council on Aging, and now with Senior Service America in Silver Spring, Maryland. CSEP provides me with income support, which is invaluable to me, along with my Social Security benefits. I was raised to believe that with enough hard work, you could survive and succeed. I received a degree in business from the University of Wisconsin at Madison. My education was financed largely through part-time jobs and federal student loans. Eventually, I was able to establish a small business. As I started this business, my mother, who had worked for a U.S. congressman, was diagnosed with Alzheimer's. I was an only child, raised by a single parent, so there was no one else to turn to for help. Putting her in a nursing home was not an option for me. For almost 10 years, I oversaw her care at home. My decision came at a price. Returning from work one night, I found my mother locked in her room and discovered that the caregiver had left without notice. I was forced to close my business and took care of my mother for another year until she died. Closing my business and becoming a full-time caregiver made me lose all that I had worked so hard to achieve. The house was sold to pay off debts, leaving me without financial resources. Today, I receive $800 per month in Social Security benefits, an amount that does not exceed my rent. My CSEP jobs, stipend in conjunction with Social Security, Medicare assistance, and food stamps, provides for my health care, food, and shelter. Cuts in Social Security, Medicare, or Medicaid would make life truly daunting. In closing, I want to convey one message to you, gentlemen and ladies. Do not abandon seniors by cutting Social Security, Medicare, or Medicaid. We cannot impose more burden on those who can least afford it. Thank you.
Before I introduce the third speaker, I want to acknowledge someone in the audience I just noticed, Terry O'Neill, who is the great president of the National Organization of Women. Thank you for being here. And who, as of Wednesday, became a board member of the National Committee to Preserve Social Security and Medicare. So thank you very much. Patricia Newsom is a D.C. resident, and we know her through her work with an organization called Our D.C.
Good afternoon. Good afternoon. My name is Patricia Newsom. I'm 61 years old. I'm looking forward to drawing my Social Security next year. But a few years ago, I was working in a hospital, in the emergency room. I'm first to let you know that I am a housekeeper, 30-plus years of experience. I was working in the emergency room one day, working. One of the doctors saw me and said, "Pat, you don't look well." She said, "It's not from the workload." She said, "You need to come here and sit down." She tested my blood sugar levels. It was 800 and something. She admitted me directly. I've been on insulin ever since. A few months after that, I had to resign from the hospital to take care of my mom. My mom was bedridden. She was not financially stable to take care of herself. She used to do housekeeping work, but it was days work. Back in that day, they called it days work. She cleaned up rich people's homes, so she didn't have Social Security or none of that. Anyway, a few months later, my mother passed. I tried to get back into the workforce. I've been to so many interviews, it's sad. I don't know if it's my age, I don't know if I'm too tall, too short, or what. I don't know what it is, but I've been trying. Anyway, I didn't have any more insurance because I had resigned from my job. So I went to Medicaid. Medicaid pays for my insulin that I have to take nightly, whether my sugar is high or low. I have to take it. So if they touch Medicaid, I'm going to be hurting. Okay, I'm drawing unemployment. Okay, but I have 7 weeks left for unemployment. 7 weeks. So while everybody else is enjoying the holidays or whatever, I can't do it. I don't know if in January I'm going to get evicted or what. I don't know if I'm going to have money to buy my insulin or my high blood pressure medicine or not. They need to leave Medicaid, Social Security, and Medicare alone. Yeah. Alone. Okay? They need to leave it alone. I feel as though right now I'm on that fiscal cliff. I'm about to fall over. I'm scared. I'm scared. How am I going to get my insulin? What am I going to do? I'm going to be in the street with my friends on the sidewalk. You know, I'm going to cut it. I'm going to leave it alone now. I'm going to leave it because I'm nervous. Please bear with me. I'm going to leave you with this one thing. Some cuts never heal. Okay? None of them. Thank you. Thank you.
Thank you so much. Thank you. Our last speaker this afternoon, Diane Fleming, and we know her through her work with the Alliance for Retired Americans, a great organization.
Oh, that's Pat. In fact, Pat and I, we live in the same community. Good afternoon, everyone. A bit emotional right now. I'm Diane Fleming. I'm a member of the Retired Alliance for Retired Americans, also a member of International Association of Machinists Union. I want to tell you a little bit about Social Security, how it's helped my family. My father died when I was 3 years old. My sister was just a baby. And it was because of the Social Security benefits that my family survived. And that was my mother, and we had to go live with my grandparents. And that worked for us. So my mother is now 91. And there is no way that she could live without Social Security. She's very, very strong, but she has medical issues that our family, we have to take care and help supplement some of her care. I worked for United Airlines for 39 years. I remember you from coming in. I was at the reservations and ticket office. When the airline went bankrupt to save those at the top, I lost much of my pension. So I needed Social Security, which I took at an early age because I had to have it. So as a result, you know, it was a smaller amount. But because of Social Security and my pension, you know, I'm able to survive. I live in the Anacostia neighborhood, which Pat lives in as well. And there are many seniors that this is the only way they survive is with Social Security benefits and Medicare and Medicaid. So this is a matter of their survival. Congress needs to remember there are real people behind the issues that we debate. If you cut Social Security, it would be devastating for my mother, for me. I'm now 70, and I'm not going to be able to find a lot of employment out there, you know. Plus, physically, you know, I'm not as strong as I used to be. So but I would have to go back to work. I paid for this. You know, I paid in, I worked hard, and all of us have. And we're still paying. I do a little part-time, I still pay. So it's nothing free for us. So we need to make sure that we stay strong, vigilant, and that this does not make a change because it did not cause the deficit at all. Thank you so much. Thank you.
Diane, if you remember me from when you worked at United Airlines, I'm very impressed. I want to thank everybody who came. I want to thank all of the speakers. I want to thank the members of Congress, especially our volunteers who put in a long day. They were with us this morning on the House side. And I also want to thank Warren Gunnels, who helped, with Senator Sanders' staff, who helped put this together. He does a great job. And Senator, thank you for everything, everything.
Thank you. Let me just say this, Max, thank you very much. It takes a lot of courage for John and Nettie and Patricia and Diane to come up and to talk from their heart what Social Security, Medicare, and Medicaid mean. But the reason it is so important that we hear from you is that you're not just talking for yourself. You are talking literally for millions and millions of people who are hanging on by a thread. They're hanging on by a thread, and we're not going to cut that thread. On a personal note, I've got to tell you that I regard it as obscene to be seeing on TV and reading in the newspapers CEOs from Wall Street, the crooks who help cause this recession that are causing so many problems, telling us how we've got to cut Social Security, Medicare, and Medicaid. So the message of today is that the soul of America is at stake. The lives of tens of millions of children, sick people, elderly people are at stake. We are the majority of Americans. Not one word that has been said here this afternoon is not supported by the vast majority of the people in this country, and it is high time for this Congress to listen to the people. Thank you all very, very much.